Hello and welcome to Pace Hospitals podcast. Today, we explore the world of diabetic foot care from understanding the risk to discovering the latest prevention and treatment strategies. Joining us today, Dr. Lakshmi Kumar, Senior Interventional Radiologist and Abdominal Imaging Specialist, having wide expertise in treating and managing diabetic foot. In today's episode, he would like to discuss the causes, symptoms, and risk factors associated with diabetic foot, providing listeners with essential information to prevent and manage this condition.
Hello everyone, I am Dr. Lakshmi Kumar. I am an interventional radiologist at Pacehospitals, Hyderabad. Today we will discuss about a common condition called diabetic foot.
Dr. Lakshmi Kumar, thank you for joining us at Pace Hospitals, Hitech City. Let's understand exactly what is diabetic foot.
As the name suggests, it happens in patients with diabetes. So if the foot of a diabetic patient develops infection or wound, or if there is any loss of part of a foot, then it is called diabetic foot. So this diabetic foot is due to either peripheral neuropathy or peripheral arterial disease that develops in the diabetic patients.
What is diabetic neuropathy?
The diabetic patients have increased glucose levels and increased lipid levels in their blood. So these two will damage the nerves. So that is called diabetic neuropathy. So if the nerve is damaged, the patient will not feel sensation of pain or sensation of cold or heat in his feet. So for example, if a patient's shoe or a slipper has a stone or nail in the shoe or slipper, the patient will walk on it whole day without feeling that there is a stone or nail in his shoe or slipper. So that is one example. Also, due to diabetic neuropathy, there will be loss of hair on the skin and the nails will become thick and yellowish. So these are also other features of diabetic neuropathy.
What is Charcots neuropathy?
In patient with severe diabetic neuropathy, the bones will get repeated injuries as the patient is not able to feel the pain. So these repeated injuries will lead to deformity in the foot. That means the shape of the foot will become altered. This condition is called Charcots foot or Charcots neuropathy.
What is peripheral artery disease?
Similar to coronary artery disease, you might be knowing what is coronary artery disease, myocardial infarction or the heart stroke. In that condition, the heart blood vessels will get blocked. So that will be called the heart stroke. Similarly here, the blood vessels called arteries, which bring blood from the heart to the legs, they will get narrowed or blocked. This is called peripheral arterial disease. This can happen in any of the blood vessels in the body, but commonly this happens in the leg arteries. So what happens in this is, due to increased glucose levels and increased lipid levels or fat levels in the blood, the fat plaques will accumulate in the walls of the arteries. This will result in narrowing or blockage of these arteries. So that is peripheral arterial disease.
What are the early symptoms of peripheral artery disease?
Symptoms of peripheral artery disease, the most classical symptom they will be having is on doing some activity like walking or some other activity, exercise, they will develop pain in the calf or thigh or in the hip region, and once they take rest for some time, the pain will decrease and then again they can do the activity. This is called claudication. This is the classical symptom for peripheral arterial disease. Also, if the peripheral arterial disease is severe, the patient can develop pain even in a resting state. That is a resting pain, we call it. And if the occlusion of the arteries is severe and it is very acute, means within 1 or 2 days, if the occlusion of arteries develops and it is extensive, the patient can have severe pain and the limb may become pale, means it will lose the normal color and it will become pale and it will become cold to touch, and the limb will be difficult to move. There will be weakness in moving the limb. Also, the pulses will not be felt. So, these are all the symptoms if you develop an acute peripheral arterial disease, acute occlusion. This condition we call it as acute limb ischemia.
What are the main risk factors for developing peripheral artery disease?
So, other risk factors are smoking, hypertension, obesity, prolonged standing or sitting, that is sedentary lifestyle. So, these are all risk factors. Other risk factors like if you have a chronic kidney disease or a family history, those are also risk factors. And if some genetic conditions like increased homocysteine levels and increased fibrinogen levels, these are also predisposed to develop the peripheral arterial disease.
So, doctor, are there any specific tests or imaging techniques used to diagnose diabetic foot condition?
If you go to a doctor or a physician, he will first check your blood sugar levels, how is the sugar control, and also he will do physical examination of the foot. So in the foot he will check if there is any signs of neuropathy. By using a variety of instruments, he will check how is the sensation in your foot. Also he will check for any ulcers or any calluses, and also he will check the pulses. Then he will check how is your footwear, is it appropriately fitting to your feet or not. Also he can advise some tests to look at the arteries like ultrasound or CT or MR angiography. So with these tests we can directly visualize the vessels, how are they, is there any narrowing or not. Also if there are extensive calcifications within these arteries, then the CT MR angiography will be difficult. Then in those cases DSA, digital subtraction angiography, will be done to look at the arteries. This will be a gold standard test to look at the arteries. Also, to diagnose peripheral arterial disease, there is one test called ankle brachial index. In this test, what will you do is we will measure the blood pressure in your ankle and also in your arms, both in resting condition and after exercise. So if the ankle blood pressure is less compared to the arm blood pressure, then that is also an indication, a sign that you have peripheral arterial disease.
What do you mean by diabetic foot ulcer?
If the skin continuity is lost, that is a wound is developing in a patient with diabetes in the foot, that will be called diabetic foot ulcer. This diabetic ulcer is common in diabetic patients. It is seen in up to 15 to 25% of patients.
What are some common treatment options for diabetic foot ulcer?
The diabetic ulcer is treated by multiple doctors. It involves a team effort. It involves a podiatrist, means a doctor specialized in foot care, or if he is not available, it can be treated by other doctors, like your wound will be taken care by the plastic surgeon or a general surgeon, and your blood glucose levels will be maintained under control by a physician or an endocrinologist. And if you have any deformities in your foot, they will be corrected by a plastic surgeon or an orthopedician. And if you have blocks in your arteries, those will be opened by interventional radiologist or a vascular surgeon or a cardiologist. So these are all the team members involved in taking care of a diabetic foot patient. If a patient with a diabetic ulcer comes to a physician, he will first try to maintain the glucose levels, and then he will inspect if there is any sign of infection in the wound. So signs of infection like redness, increased temperature or swelling. So if there is infection, we will aggressively manage that infection by taking a sample from that wound and sending it to the laboratory. Is there any specific microorganism that is causing the infection, and give the antibiotics accordingly. Also that wound will be clean, that is called debridement. If there is any infected tissue or dead tissue in that wound, that will be removed. So and then the footwear will be given. The appropriate footwear which is appropriately fitting to the shape of the foot will be advised. And if there is a severe neuropathy, offloading of the wound means to decrease the pressure on the wound, some special kind of shoes or braces or casts will be advised. So, and if the ulcer is not healing for 4 to 6 weeks, then we will investigate aggressively for any vascular disease. So, if the vascular disease can be treated, it will be advised for treatment.
Are there any alternative or complementary therapies for peripheral artery disease?
It will be treated by either surgical means or endovascular means. Surgical means the artery which is blocked, it will be bypassed using a bypass graft. Bypass graft means placing a artificial blood vessel like tube between a normal artery and a normal artery distal to the level of block. Means the block level will be bypassed from above to below. There will be a new connection, that is called a bypass graft. So that is one way of treating. So if the patient does not have a suitable vein to do the bypass graft, or if he is having disease in the foot arteries, that means very small arteries, or if he is having multiple diseases or old age, then he will be not fit for the surgical treatment. In those cases, interventional radiologist's role is paramount.
What does an interventional radiologist do for peripheral artery disease?
We will do angioplasty or stenting for the blocked vessels. So what we do is we will insert a small wire into the diseased artery or blocked artery. Over that wire we will insert one balloon, and with the help of balloon we will open the narrowed lumen. And to keep that narrowed lumen open, we may sometimes require to place a stent there. So these are the main treatment options that we have. That is one angioplasty, that is physically opening the narrowed artery with a balloon, and second one is stenting. So what are the results of angioplasty and stenting? So we have 80 to 100% success rate with these procedures, and the complications rates are very less. So 2 to 4% complications rate. So this can be avoided by meticulous technique and careful post procedural monitoring.
So, doctor, how to prevent diabetic foot ulcer?
The diabetic patients needs to maintain their glucose levels in an optimum manner, and also they should avoid smoking, and they should have a regular supervised exercise program, and the footwear whatever they wear, they should be appropriate to the shape of their feet. Also, depending upon the stage of the diabetes, you need to visit the physician every year, or if the disease is severe, every 1 to 2 months. So in that period of examination, the physician will examine is there any signs that indicate that the ulcer will develop in the future. Also, you need to regularly examine your foot daily, even the under surface of the foot. If it is not possible to look at the under surface of the foot, you can use a mirror, or you can take help of other persons. So, and the next thing is you need to avoid soaking the foot. That means keeping your foot in the water for a long time. Also, while sitting or sleeping, you need to keep your legs at a higher level compared to your heart level, and during sitting or standing, you need to wiggle your toes to keep the blood flowing in your legs. So these are all the things that you can do to prevent development of diabetic ulcer.
What are the different stages of diabetic foot disease?
There will be no evidence of diabetic neuropathy or peripheral artery disease or foot deformity. In second stage, there will be diabetic neuropathy, but there will be no evidence of peripheral artery disease or foot deformity. In third stage, either peripheral artery disease or foot deformity is present along with diabetic neuropathy. In the fourth stage, there will be a foot ulcer or there is a gangrene in the foot.
What is gangrene?
If any part of the body due to lack of blood supply, if it dies, then that is called gangrene. So this gangrene usually develops in diabetic patients in the foot due to either wound or infection in the foot. So this gangrene may require amputation, that is a removal of that part of the body to decrease the spread of infection or the spread of gangrene to other parts of the body.
Thank you, Dr. Lakshmi Kumar, for sharing crucial information regarding the diabetic foot to our listeners. If any of you have any further questions regarding diabetic foot, please don't hesitate to consult an interventional radiologist. Diabetic foot is a serious issue that can lead to devastating consequences, but with the right knowledge and care, you can significantly reduce your risk. We will see you soon with another episode on Pace Hospitals podcast. Until next time, stay informed, stay proactive, and take care of your health. Thank you.